Hi, I'm Ken Schultz, a licensed sales representative with Humana, and I'm here to talk with you today about the Humana Walmart Preferred RX plan. Most people on Medicare take at least one prescription drug and are familiar with how Medicare Part D prescription drug coverage can help protect you from high out-of-pocket costs. Sometimes the biggest question is, what drug plan should I choose? Although we're here today to talk about the Humana Walmart Preferred RX plan, it's important to look at your options and then choose a plan that you're comfortable with. After the presentation, you may still have a few questions, but you'll have an understanding of how Medicare's prescription drug coverage works, what you need to join, and what the Humana Walmart Preferred RX plan has to offer. Here's what we'll cover today. First, I'll talk about what you should know regarding Medicare prescription drug coverage. Then, we'll talk about the various ways you can get coverage. Next, we'll review the Humana Walmart Preferred RX plan. Then, we'll cover some important dates you need to know. And finally, I'll tell you where you can find more information. So, let's get into the basics. Medicare prescription drug coverage, also known as Medicare Part D, was set up to help you save money on prescription medicines. Medicare prescription drug plans are available only from private insurance companies approved by Medicare. Humana is one of those approved companies. You can still enroll in a Part D plan even if you haven't had prescription drug coverage in the past. If you haven't enrolled in a prescription drug plan, you may have to pay a penalty for late enrollment. And the longer you wait after you are first eligible, the higher the penalty will be. So even if you are eligible but missed the initial deadline of May 15th, 2006, when Medicare Part D was first offered, you can still save money by enrolling now. The penalty keeps increasing as time goes by. So, are you eligible for a prescription drug plan? It's easy to find out. Medicare prescription drug coverage is available to everyone with Medicare. That means Medicare Part A or Part B or both. To enroll in a prescription drug plan from any insurance company, you need to live in an area where that plan is being offered. That's what we mean by plan's service area. To get prescription drug coverage, you must join a Medicare-approved plan offered by a Medicare-approved organization. Medicare has approved the Humana Walmart Preferred RX prescription drug plan. That's all there is to it. Now, let's talk about how you get prescription drug coverage. There are a couple of ways. Humana wants you to select the plan that best meets your needs and budget. Your first option would be to join a standalone Medicare prescription drug plan that covers prescription drugs only. The Humana Walmart Preferred RX plan is a standalone plan. A second option is to join a Medicare Advantage plan or another type of Medicare health plan that covers your doctor and hospital care as well as your prescriptions. Now, this is really important. First, if you're already enrolled in a Medicare Advantage plan, other than a Medicare Advantage private fee-for-service plan that does not include Part D coverage, and then you also enroll in a standalone prescription drug plan, you will automatically be disenrolled from your Medicare Advantage plan in most cases. So, if you do have a Medicare Advantage plan, you'll want to talk to a representative about your options before you take action. Let me repeat that. If you are already enrolled in a Medicare Advantage plan, other than a Medicare Advantage private fee-for-service plan that does not include Part D coverage, and then you also enroll in a standalone prescription drug plan, you will automatically be disenrolled from your Medicare Advantage plan in most cases. So if you do have a Medicare Advantage plan, you'll want to talk to a representative about your options before you take action on any prescription drug plan. Be sure that you share information with your agent about the kind of coverage you have now so you are not inadvertently enrolled in a plan combination that CMS does not allow. Second, if you're already enrolled in a Medicare Advantage plan that includes prescription drug coverage, you don't have to take any action at all to receive the benefits. So, if you already have a Medicare Advantage plan that includes prescription drug coverage, you don't have to do anything. You'll be enrolled in prescription drug coverage automatically. Now, let's look at your benefits in a Humana Walmart Preferred RX plan, a standalone prescription drug plan. This plan has a $325 deductible that must be paid by you for your prescription drugs first before any benefits begin. Humana and Walmart have come together to bring you a standalone prescription drug plan at a very affordable price. We combine the best of both companies to bring you cost savings, convenience, and confidence. A low $18.50 monthly premium. You will also pay $1 copayments when you fill your preferred generic drug prescriptions at more than 4,000 Walmart or Sam's Club pharmacies nationwide after you reach the annual deductible. The $1 copayment level is for most of the same medicines in the Walmart $4 program. You can receive Tier 1 and 2 prescriptions at no cost to you when you use RightSource RX, the plan's preferred mail-order pharmacy, after you reach your annual deductible. You will pay more for your prescriptions if you get them filled at a non-preferred pharmacy, meaning a pharmacy other than Walmart, Sam's Club, or RightSource RX. The coverage I'm talking about applies to drugs covered by Part D. Now, let's review the plan benefits, deductibles, and copayments for both preferred pharmacies and non-preferred pharmacies. Once again, the annual deductible for the Humana Walmart Preferred RX plan is $325 and applies to all tiers. Column A shows the drug tiers. Tier 1 is preferred generics. These are the same drugs used in the Walmart $4 prescription program. Tier 2 is non-preferred generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred brand drugs. And Tier 5 is specialty drugs. Column B shows what you'd pay for a 30-day supply at a Walmart retail pharmacy or Sam's Club pharmacy. That's $1 copay for Tier 1. Now, these are many of the same generic prescriptions that are generally $4 at Walmart. With this new plan, you can get those same generic drugs for $1. For Tier 2, you would pay a copay between $3 and $5. Tier 3 is a 20% coinsurance. Tier 4, a 30 to 35% coinsurance. And for Tier 5, a 25% coinsurance. Column C shows what you pay at a non-preferred retail pharmacy. Your copay will be between $6 and $10 for Tier 1 and between $8 and $33 for Tier 2. 25% coinsurance for Tier 3. Tier 4 between 31 and 50%. And for Tier 5, a 25% coinsurance. And column D shows your copayment for either a 30 or 90-day supply when you use the RightSource RX mail order option. For both Tier 1 and 2, you would pay nothing. That's right, a $0 copayment for Tier 1 and 2 after the deductible. There would be a 20% coinsurance for Tier 3, between 30 and 35% on Tier 4, and 25% for Tier 5. The important thing to note here is how little your copayment can be if your doctor can prescribe preferred generic prescription drugs and you fill the prescription at a Walmart pharmacy or use the RightSource RX mail order option. Also, no membership is required to use the pharmacy at Sam's Club. Keep in mind that other retail and mail order pharmacies are available in our network. You just pay more at non-preferred pharmacies. Now let's talk about the coverage you receive in the gap. You probably heard of the coverage gap, or donut hole as it's sometimes called, in Part D prescription drug coverage. At one time, if you fell into this gap, you had to pay the entire cost of your prescription medicines. Not so anymore. Again this year, there is help for those who enter the coverage gap. Due to the Healthcare Reform Act, there is a discount once you reach the coverage gap, and you will only pay 79% of the cost of many generic drugs and generally no more than 47.5% for many brand name drugs. This is good news because it means you save money. It used to be that once you were in the coverage gap, you were responsible for paying 100% for the prescription medications. The agent discussing this plan with you today will be giving you more information on when the coverage gap begins with this plan in just a while. People with Medicare who receive a low-income subsidy or are enrolled in an employer-sponsored retiree drug plan, with the exception of employer groups with waivers, won't be eligible for this discount. And not all brand name drugs will be covered under this discount. The manufacturers must agree with the federal government's Center for Medicare and Medicaid Services terms and conditions in order to be part of the discount program. Again, the agent discussing this plan with you will be giving you more information on this. Let's look at what's called a formulary. It's simple, really. The formulary is the list of medicines covered by each prescription drug plan. You need to make sure that the plan you choose covers the drugs you use. And note that the Humana Walmart Preferred RX plan offers many brand name and generic drugs with more value and greater savings for you. So before you decide on a plan, consult with a knowledgeable representative about the specific drugs it covers. And you can also look up your drugs and the cost on our website at humana-medicare.com. Now that you know how to get prescription drug coverage, let's talk about when you can join a plan. October 1st through October 14th is pre-enrollment. That's when you should compare the plan options and costs to decide which plan is right for you. You cannot enroll in a plan until October 15th. October 15th through December 7th is called the Annual Election Period, AEP. You can enroll in a standalone prescription drug plan, or you can enroll in a Medicare Advantage plan that includes a prescription drug benefit. You also can change from one Medicare Advantage plan or prescription drug plans to a different one during this time if you prefer. December 7th is the last day to make a plan selection for this year. Your plan selection becomes effective on January 1st. January 1st through February 14th is called the Annual Disenrollment Period, ADP. During this time, people who already have Medicare Advantage plans can return to original Medicare. If you decide to do that, you will be allowed to enroll in a standalone prescription drug plan. You will no longer be able to switch Medicare Advantage carriers during this time. February 15th through October 14th. During this time, you are generally not allowed to make plan coverage changes unless you move, qualify or lose eligibility for Medicaid, or have some other special circumstances that apply to you. Since this is an overview, I suspect you may have some questions. Here's where to get answers. Your Medicare and You Handbook, which you should receive in the mail from the Centers for Medicare and Medicaid Services. You also can go to www.medicare.gov. It's the Medicare website and contains a lot of helpful information about Medicare benefits and prescription drug plans. You can also call 1-800-MEDICARE or its TTY line 1-877-486-2048 to get your answers to your questions 24 hours a day, 7 days a week. And you can call your local state health insurance program. And you can always talk to your local Humana sales agent. For details, you should talk personally to a Humana or authorized sales agent. When you do so, make sure he or she goes over the following documents with you: the summary of benefits and the drug formulary. Thanks so much for your attention. For Humana, I'm Ken Schultz.